There are some tests for IgG4. They are commercially available. They cost a lot of money. What do you think is the value of IgG4 tests?
We don't think they have any value in chronic spontaneous urticaria because it's not an allergy. It's not the immune system reacting to these foods. It's an intolerance which cannot be detected by such tests. In fact, these tests can do harm. We see patients who come with the results of such tests and they avoid all kinds of foods, sometimes a lot of foods, thereby restricting their diet. And that's not good. It's bad enough to have urticaria. No need to make it worse by staying away from a lot of different foods and suffering from this as well. So no, we don't recommend these tests. In fact, we recommend against the use of these tests to guide us in trying to find the underlying causes. As I said, it is not easy. No blood test, no skin test will do this. It needs to be based on the elimination, observation, and on provocation with food components to diagnose intolerance to food as the underlying cause of chronic spontaneous urticaria.
Imagine a patient who kept his diet for 4 weeks, his pseudo-allergen-free diet for 4 weeks, and there was no improvement at all. What would you recommend, how would you recommend to proceed?
Well, if you kept a diet that eliminates all food components that can cause intolerance, you can be sure that you do not have your chronic spontaneous urticaria because you're intolerant. So there must be another underlying cause, and some of these underlying causes we can look for. We can screen for infections, and in my experience, some patients have their chronic spontaneous urticaria because of a tooth problem, or a problem with their tonsils, or bacterial infections of the stomach. Helicobacter pylori, for example, is one of these infections that can be the underlying cause. We can look for that. We can screen for bacterial infections and thereby rule out or prove that this is the underlying cause. Other patients are allergic to themselves. So they build an immune reaction to something in their body, just like an allergy, say against cat, but it's not cat, it's the own body that the immune system reacts to. We can look for that. We can do tests to determine if you are allergic to yourself and if this is the underlying cause of chronic spontaneous urticaria. Some patients have an autoimmune urticaria, and we can find something in their blood that activates the skin mast cells to form wheals and angioedema, and we can look for this by a simple skin test. So even if you do not respond to an elimination diet and you don't have intolerance urticaria, it does not mean that the underlying causes cannot be found.
What is the relation between autoimmune urticaria and other autoimmune diseases like lupus or thyroiditis?
In some patients, urticaria is linked or associated to another autoimmune disease. This is, for example, the case with lupus, where some lupus patients develop urticaria before they then show signs and symptoms of lupus. More commonly, patients have autoimmune urticaria and another autoimmune disease, for example, Hashimoto thyroiditis or another autoimmune disease, and we're not sure what the link between the two is. What we know is that autoimmune diseases are more common in patients with chronic spontaneous urticaria, and some of them may be linked so that one influences the other.
Would you recommend a thorough diagnostic to autoimmune diseases in all patients with chronic urticaria?
Patients with chronic spontaneous urticaria have a higher risk of having autoimmune disorder. So we should explore that, and we should ask for the signs and symptoms by clinical evaluation, by taking a good history. And if there's a clue that there may be another autoimmune disorder, yes, then it should be diagnosed. In patients, chronic spontaneous urticaria patients with long-standing disease, years of problems, daily problems and high disease activity, yes, I do think it makes sense to check for possible underlying causes, including autoimmune disorders. Would I do this test in every patient? No. Many patients can be helped without these tests. In many patients this is not necessary, so it depends on the individual patients. Do I need this information? Is this information useful? Should I do the test or not?